natural beauty will no longer exist.
I'm thinking way ahead into the future. I'm thinking social media is going to grow quite a bit. Our beauty trends are going to change. AI is going to integrate with medicine, and that's going to change beauty and how easy it is to go in and receive these surgeries. So yeah, in a lot of ways, I think the trend is definitely not towards what's natural. As human civilization is trending altogether towards what's unnatural, and I think that will apply to beauty as well. It makes me sad to think that we live in...
That's an interesting point of view, but I would ask her to think about when there have been movements in the past, there's always a counter movement, there's always a culture and a counterculture. And that applies to beauty standards, that applies to AI. We don't just roll over and take it when things change. We, in some ways, in a lot of ways, rightfully so, ask the hard questions. Why should this change? Change can be good, but change can also just be change that's not necessarily applicable to me and my life and how I live my life. While I think that there is a push towards innovation, technology taking over, which also can be a little scary. I think of 1984 and I think of, these movies, like Hunger Games and all of these other kind of dystopian universe kind of movies. Mad Max. I don't know that that's our future. I think when I was 15, I thought by now we would have flying cars. And we don't. Right? We're still driving gas engines. I'm still driving a gas guzzler. So I think there's always going to be a little pushback. And so that keeps us from going off the deep end.
Society that doesn't want to see people age normally. And I say that as somebody who deals with insecurities myself. I don't know that when I'm 50, what my face is going to look like and how I'm going to look in the mirror and how I'm going to perceive myself. But I would hope that I've fortified this sort of philosophical idea that I have about beauty so much that I won't feel the need to change myself in any way. Young people, old people, everybody's going to be engaging in this practice, even men, as we're seeing them sort of get into plastic surgery now as well. It's strange to me to think that we're not going to see what people were actually meant to look like.
Do you ever feel tempted to get a procedure done yourself with all this pressure and societal pressure?
Not with all the thought that I've put into it, but I can say from the moment I was able to perceive myself and perceive insecurity, I felt it. I can't tell you how many times when I was a teenager, I thought, oh, let's just get a rhinoplasty. Let's just slope the nose a little bit and fix it. But yeah, the more I've thought about it though, the more I'm thinking, I really want to know what I look like when I'm 70, 80, and what I was supposed to look like. And I want to experience life and experience the wear and tear that.
What does that mean, it's supposed to look like? That's the question for me, because it's all about lifestyle, right? And it's all about balance and maintenance. And the question of maintenance can be different things to different people. But this is supposed to look like shoulda, woulda, coulda. We gonna look how we gonna look. If you got a nose job at 18, and you're thinking to yourself, I want to know what I would have looked like at 70. I mean, you probably wouldn't have looked that much different, to be honest.
In the body, so I don't think so.
For me, when COVID hit and we had to shut down our offices for 2 months and I wasn't doing things to myself, I was looking in the mirror, I was like, holy shit, is that what I actually look like?
Right.
I ran to the office, grabbed a couple boxes of filler, brought it home and started shooting myself up in the face. I'm like, restore.
Right.
So I think it's really honest, to say that
That sounds creepy to me too. Girl. Okay.
You don't know how you're gonna perceive yourself when you're 50. You're probably still gonna be gorgeous and great, but you never know. And I think it's good to leave that door open. It's armamentarium in a toolbox, but for me, I think that what's gonna happen is it's gonna become so accessible. Imagine you go to Rite Aid and there's a machine that scans your face, does an ultrasound, knows exactly the level of your thickness of your skin, knows where your muscles are. It generates a hyaluronic acid / Botox mask with, little, not needles in it, but the hyaluronic acid is shaped as needles. You put it on your face and you press. You've just delivered Botox to your face, you've delivered hyaluronic acid filler to your face, and it's going to become that accessible.
Natural
Wait, is this
beauty.
something you know is coming?
I think that this is where
She already
we're
had it.
You know what I mean?
Can I invest?
Didn't that intrigue you a little bit? So I think when it becomes that easy and affordable and accessible, then yeah, people.
Again, maybe I'm just not inventive enough to think that far ahead or to think that kind of reality exists. But I just don't know that we're there, and I don't know that we're ever going to get there, because there always is this action and reaction that kind of pulls us back. It kind of pulls us back to where our starting point, or near our starting point. So we never actually reach this very futuristic level. We get closer, but we never really get to that level, because there's always this resistance to do that. And I would be resistant to go to Rite Aid for some random Botox. That to me doesn't sound safe, good. I might invest because some of y'all might do it and then I'll make some bank. Hey, but no, that sounds like a bad idea.
Gonna say, heck, why not? Why shouldn't I do a little skin booster?
Yeah, I completely understand. Like I use a collagen booster in my coffee. I'm going to continue drinking my collagen. I also take a calcium supplement because I know I'll stop building reserves in a few years, right? Surgery is much more my concern. I have a very Slavic nose, and it's very specific in my head. I hated it for the longest time. I wanted the little button Western European nose. It's what I wanted. And it took me a long time to be like, no, this is the same nose.
And if she'd had it, I don't think she would look as good as she looks right now. Just my opinion.
Like my grandpa came over from the Czech Republic. And I think we start losing that, and I think we start losing a lot of individual cultural beauty in order to fit whatever aesthetic is being pushed.
I think, again, we're talking about two different things. You're talking about changing beauty standards. I'm talking about staying youthful looking like you, but looking your best for as long as possible.
But that doesn't concern me.
What is looking your best, though? If I am 90 and my face is not full of wrinkles that tell a story of my life, I don't think that's looking my best. I think that sounds like I look crazy. So that's another question I have.
That doesn't concern me in terms of losing natural beauty, because to me, natural beauty a lot is a lot of whatever your ethnic group's beauty is, like beauty within your ethnic features, because that includes body types, right? When we start pushing people to change, you're erasing the beauty that can be found within their natural phenotypical expression.
Just so you know, though, in the plastic surgery world,
Yeah.
we have books on ethnic noses. We have
Yeah.
books on ethnic breath. We have books on this stuff to keep people within their
time.
Oh, girl. I'm sorry. We have books on ethnic noses. Yes, we have ethnic rhinoplasty books. That does not mean that there are not tons of surgeons out there creating white women-based standards in terms of their rhinoplasties. Button noses have been what we are taught are great noses, are perfect noses. To say we have ethnic rhinoplasty books means that we are going to absolve ourselves from creating or learning these standards based on a white woman ideal and then propagating them throughout the world by changing people's noses and appearances to kind of come towards this white woman ideal standard. And even the ethnic rhinoplasty books, their basis is the white woman standard. It's the deviation from the white woman standard. So let's not talk about it in a vacuum as if we know all these things about diversity. Again, we don't promote diversity in plastic surgery. We promote uniformity. We promote standards. We promote beauty standards. And unfortunately, the beauty standards that we learned are the beauty standards of the white woman ideal. Point blank, period. That was a statement that I don't agree with it at all. Sorry, I'm getting a little...
Erasure kind of thing.
No, we don't even think of it as erasure, but just respecting that person's anatomy and phenotype and just optimizing it for them.
I think especially in an economy, people can't even afford groceries right now. Some people can't afford to put gas in their car. I don't think we're literally anywhere near where everyone is going to have lip filler and have a nose job.
Much love to Daphne, because Daphne has a truly I don't give a fuck attitude, and I'm here for all of
To get lip filler, like where I'm from. It's just because everybody.
But it is getting more accessible.
Accessible, yes, but I don't think natural beauty is gonna go away 100%. So perfect example. I mean, yes, that sounds really cool. What you were saying, like the sheet, you scan your face, whatever. But at the end of the day, it's always gonna be like the cheaper, riskier alternative. I've had friends be like, "Oh my god, my friend's becoming an NP. Like she'll do your things for free," and I'm like, "I'm good."
But that's
like,
your standard, right?
Yeah.
I love it.
But I've said the same thing about, say, electronic vehicles. People thought, oh, the rich are only going to have those. It's never going to trickle down to normal people. Or the iPhone, smartphones. People thought only rich people would have access to those. But as we develop...
it'll be more accessible, but I don't think everyone's going to do it. It's always more annoying to get things done. It's more effort to get things done than it is to not. And most people are lazy and most people don't want to spend the money.
I feel
Exactly, I agree. I don't, again, I'm here for Daphne. Again, I agree, there's a counterculture. It's not going to be everyone's racing to this futuristic finish line. We're gonna keep getting pulled back into this middle ground, and I think that's where we should be. Things are gonna push us forward, but things are gonna pull us back, and that's where we should be, in the middle ground. Not futuristic, not, archaic in the past, but somewhere right in the middle. We don't live in a world of extremes. Most of us don't live in a world of extremes, So it doesn't make sense that all of a sudden we'd get to an extreme and be happy in that extreme. No.
if we look at something like braces, right? Braces are mostly aesthetic. And at one point,
Disagree.
nobody got braces. Now everyone's like, I personally haven't had braces. So like,
Braces are not mostly aesthetic. Let's not propagate that thought. Chewing is real, talking is real, and dental anatomy and configuration is largely responsible for controlling how we chew and how we talk. Yeah, braces can be aesthetic, but there's a serious functional component, so I don't agree with castigating them as mostly aesthetic. That doesn't seem right to
purely
me.
by luck.
You're
I
saying
never
it's
needed
now
that.
so normal.
It's
for
now
people
so
to
normal
have
though that people are
braces.
very surprised when I'm like, nope, didn't have them. And I feel like we are moving in that direction. Like when I say I don't have tattoos, a lot of people are really surprised. I don't actually have my ears pierced. A lot of people are really surprised. All of these things, all these alterations, they do become so normal. And I'm not obviously not condemning anyone with tattoos or piercings or with plastic
I
surgery
think
for
there's
that
too
matter.
many to go down that
But-
rabbit hole. I don't think insurance is going to cover like Botox and like I think there's too many elements to that. Like braces, insurance came in and helped with that. There's a lot of other things.
That's-
that
I
go
think
into
we're
that.
not
that's a fair
thinking
point.
far enough into the future about how easily it's going to be. Like we're using examples of like filler and Botox. These might not even be within the realm of cosmetic surgery 50 years down the line once we've made advancements. When we're talking about the accessibility, we're going to be talking about very qualified plastic surgeons like Sheila, who are giving these procedures to normal people. And it's not necessarily that all natural beauty is going to be erased and nobody's going to have the face that they...
Again, unfair to have a plastic surgeon in this discussion. I totally agree with that. Really unfair. She should not have been involved. And that's no fault of hers. That's the fault of people who asked her to be involved in this discussion. I don't think she should have been involved.
born with.
Yeah.
It's just to say, is the rate of intervention when it comes to beauty going to be higher than those
100%.
staying natural?
So how do you all feel about the fact that a lot of people are going through procedures to specifically like get rid of certain ethnic features they have, or to maybe even look like another race?
As an Asian woman, I'm naturally thin, I have no curves like I mentioned before, and obviously this beauty standard of having curves comes from African American and Spanish culture, and I admit it and I appreciate it. I don't think it's a bad thing, I don't think it's inherently bad, I think it's just different.
Yeah, a lot of people that talk.
We're not normally using the African American and Latino population as our guide, as our compass, as our standard. So that's where it's very dangerous.
White supremacy or Eurocentrism, but with BBL culture now, like you said, that's Latin and African American.
Mm-hmm.
A lot of people are going in to get plastic surgery on their eyes to look more East Asian.
Mm-hmm.
With noses, we typically tend to fall into this more Eurocentric standard. But also a good plastic surgeon, in my opinion, would look at your ethnic features and would think about preserving them. It would be more focused on an idea of symmetry.
Oh gosh, are we, sorry, again, like what, why would she, like again, she shouldn't have been involved in this discussion. And the fact that Amala made a point about what a good plastic surgeon is, and then Christy points to Sheila Nazarian as if, you know, she's the example. Like I don't, no shade to Sheila Nazarian. I think she's a great plastic surgeon, and I think she has a lot of good results. and obviously is very popular, more popular than me. So maybe that's why I'm hating a little bit. But no, I do think it was unfair to have her in this discussion. I don't think it was right. I think it should have been people who fall in the camp of I've gotten plastic surgery or I believe in plastic surgery versus I believe in natural beauty. And that should have been it, point blank, period. But having a plastic surgeon there as the expert is unfair. There's always a bias then to the conversation because she's present. And it takes away from having a very honest conversation about what the implications are of being either a person who's team natural versus team plastic surgery.
Than erasing what is something that is typical for your ethnicity.
I totally agree with you, and I will tell you, I don't speak for all plastic surgeons, but we have books on, how to preserve ethnic beauty. Asian grandparents, when there's an Asian baby, will massage their nose to try to give them a bridge. A lot of Asian women will go in and actually have cartilage inserted to give them a bridge. Where do you draw the line?
I know about like the eyelid thing.
The double eyelids,
eyelid.
yeah. And sometimes I've heard from Asian patients, like, I can't wear glasses because I have no bridge. Like, it'll literally slide off. Like, if I don't do something, I'm gonna have to go get an eye surgery instead to get LASIK, so then I won't need the glasses anymore. So again, I think we shouldn't just say line in the sand no, and we shouldn't say line in the sand yes, and it's really more nuanced again.
I was made fun of for like not being able to see, open your eyes, and now everyone's like, oh, I'm getting the fox eye, I'm getting this, and they're not admitting where it actually comes from. And that's why I like to give credit where credit is due.
Does that bother you, by the way, that people are...
Oh yeah, I'm like, just call it what it is.
If you won't acknowledge where things come from, like, and you're just gonna hop on any trend that follows, like, oh my God, like, those type of eyes are in, I'm going on, oh my God, like, big butts are in, I'm gonna go on that, like, then you're just dumb. Like, you have to follow what you like more. Like, for some reason, I've never been inclined to get a boob job. A lot of my friends have one. It's just like, that's not the look I like. I think we are in a generation where everyone's like so coddled and like so nervous. Like, oh my God, I have to look this way. And it's like, you don't look that way. So if you either change it when you get older, or you don't. I don't know.
I just realized, girl in the beige shirt, has she said anything? Has she offered an opinion? I don't think I've heard her.
Sounds like a
So
little harsh.
what would you say motivated you towards your procedures?
So I've just gotten my lips done, I mean, just because I wanted bigger lips, I had like no upper lip before. Even as a kid, when I was like playing with my mom, like our family's makeup, like my cousins and I, my cousin would be like, damn, you have no upper lip. And like, I'm Hispanic, I'm Cuban and Dominican, and I have like no lips, you know what I mean? Which is not really the standard. Who doesn't want some face symmetry? Who doesn't want an upper lip? Like little things like that. I mean, I'm a little overdue for Botox. I go into tanning beds a little too much.
Please don't do
And
that.
just because,
I know, I'm sorry, everyone hates me for it, but
I feel like just because you do something as well doesn't mean that you're trying to mimic another culture as well.
Yeah,
Because
exactly.
back in the day, having big breasts was our Caucasian thing, right? It was more the, we were the booty, Caucasian was more getting the boobs, the Pamela Anderson boobs. And just because you get lips, it doesn't mean that you're trying to be black or any of those, I think, stereotypes. And if you get your nose done as someone who's Puerto Rican, and they look at me and they're like, okay, well, what you didn't like your nose before? No, because I just wanted it done.
I don't know.
Now, if your
why it's even come to
intention
that.
is to look like another race, I think that's a different conversation.
Yeah, and I just think that's weird. I don't think anybody's really looking in the mirror being like, I'm doing this because I want to look like a different race. It just happens to be a feature that is usually stigmatized towards a certain
Some people
race.
are, though. Some people are trying to look like elves.
Yeah.
Okay.
Okay.